25 minutes to 10 o'clock. Well, let's continue our discussion now. This time we're talking your sexual health. I'm joined by Dr Mpume Zenda, obstetrician and gynecologist, and Dr Tlaleng Mofokeng, also known as Dr T. She's the author and she's a GP, and her book titled A Guide to Sexual Health and Pleasure makes her one of the perfect people to talk to this morning. Docs, good morning, and thanks so much for taking the time out to be with us this morning.
Good morning, Rebecca. How are you doing?
All right, so let's talk about, firstly, we talk about sexual rights when it comes to a woman's sexual health. What do we mean by sexual rights? And I know it's more than just about your right to say no. Dr. T, enlighten us about our sexual rights as women.
It's important to talk about our sexual rights, especially when you talk about, health care services and access. We just heard a few minutes ago, you were interviewing someone about the HIV. And it's important to realize that the right to make decisions about your body are part of sexual rights. And what's amazing and important about this is that it takes back the power and gives back to women and young people to make these decisions about their lives. The rights to make these decisions are very, very important, and they are promoted by access to this system.
Dr. Mpume, so when we talk the difference between sexual rights and your sexual health, what is it that you tell your patients? What is it that you tell women about their sexual health and what it is they need to be doing?
Right, so it's always quite an important match to match the rights and the policies with actually what happens in real life. And I think, you definitely got the right people in the sense that my biggest focus is how do those rights, those policies translate? Do women actually access health? Do women actually get everything that they need? And in the decisions that they're making, are they being implemented in a tangible way that actually makes their lifestyle better and more fruitful?
So are South African women actually, are we aware of what our bodies should be, how they should be functioning, what we should be doing with our bodies, what should be done to our bodies so that we're living our best sexual selves, Dr. T?
It's very important, and I always assist, women, especially young people, because the truth is that it's very daunting and sometimes quite anxiety-inducing to be a young person who must engage with the public health around your sexual and reproductive rights and access issues. So to keep a medical diary, all of us have mobile phones now, keep that app and trace and input your symptoms that you feel and write how those impact your quality of life. Track your cycle and all the symptoms associated with your premenstrual syndrome, for example. Quantify your pain as much as you can, because the minute you see a nurse or a doctor, you are able to advocate for yourself better in the consultation one-on-one with knowledge that's very specific about your body, and you are better positioned to then discuss holistically the different types of interventions and treatments that are best for you. Because sometimes it is really just about improving the quality of life, especially when some conditions are incurable, but the quality of life is different. So one of the ways to encourage people and women in general to really note down and keep track of their cycles and the changes in their bodies.
Dr. Mpume, do we find that sex and what women need to be experiencing and how they need to be living their lives, is it a top priority for South African women? Are we so busy doing other things that we think, oh, that's just by the by, it's become a duty for us, it's become a chore? Are we asking for what we want? Are we enjoying our sex?
I think we are getting there, but by and large, a lot of women still are sort of like captured by stereotypes, by the myths that, sexual pleasure in particular is for the man. We are still, whether it's a cultural thing, whether it's religious things, whether it's just how we ourselves are not aware of our own bodies. So there is still a lot that needs to be done. And to the previous question as well, it is so important that a woman takes the responsibility of learning about their own body, of asking the questions. I know a lot of the time there's this discrepancy between when somebody is in the consulting room where they feel like the healthcare speaks to them rather than them. It's a communication and a conversation. So there is so much that needs to be done in women taking responsibility and understanding their own bodies, but also advocating for themselves every single time, whether it's in the bedroom, whether it's in the consulting room.
Well, Dr. T, in your book, A Guide to Sexual Health and Pleasure, I mean, you talk about the big O, the orgasm. And I mean, there are some pictures here, and I didn't know that 3 people could actually do that. But anyway, we won't show the pictures right now. But the big O, I mean, are South African women experiencing the big O? Are they? Or are they going through this purely for their partners and not experiencing the joy of sex for themselves?
It's so important, to talk about sexual pleasure. And I always say that it's so important, especially when you're talking about safer sex tools, right? Because that's really important. First is consent. Next is prevention of STIs and unwanted pregnancies. And once the anxiety is gone and you've done all of those 2 steps, you are actually better enabled and more affirmed to actually enjoy sex without too much concern and worry. Often a lot of women tell you that they don't enjoy sex because of this constant threat of getting pregnant. And funny enough, postmenopausal women, are the ones that even in research will subjectively tell you how their sex lives has improved. And so there is something to be said about, women still carrying the burden of prevention of HIV and pregnancy. And some, especially younger people, they are getting more and more inquisitive. They are looking for content. And hence I wrote that book. It is a medical guide done by a medical health professional. So the advice is based on evidence research. And of course, we have one and it's important. And I think more and more people are open to the idea of owning their own sexuality and sexual pleasure.
Yeah, even if you're doing it by yourself, right? You have a right to.
That's the safest form of sex in any case, even during COVID-19. So always,
You're your own best partner at the moment. And I'm so glad, Dr. T, that you mentioned postmenopausal women, because Dr. Mpume, I mean, you can be old but not cold, right? I mean, we're seeing the different stages. We're seeing so much more awareness about older people and their sexuality, older women and sexual health as well now.
Absolutely. And I think we often marginalize certain groups, whether it's menopausal women, whether it's elderly women, whether it's disabled, whether it's in the LGBTQI. It is so important to understand that sex and sexual pleasure is for everybody, regardless of the age, regardless of what your background is, your choices and decisions are. Sexual pleasure is a right for every single human being.
And you need to learn to ask for what you're doing. And do we find that when that there's a big cultural element to this, that in certain cultures, women are, I don't know if they're not allowed, but they feel that they can't express that, yes, I'm a sexual being as well. You need to do this for me and to me, and and because I also need this as much as you do. Is it a big cultural aspect to this?
Oh, yeah.
All right, Dr. T, we'll take you.
Okay. So it really is. And remember, the cultures may be different around the world and religious beliefs may be different. But the power dynamics that drive all of these religions and culture is around patriarchy and power. And where the power lies in relationships is often what determines what happens, when sex happens, and how it happens. And the important discussion to talk about, it's the fact that we need to have young people who understand power dynamics, who are able to negotiate with the right language and the right confidence their own relationships, because part of good sexual health is having healthy relationships. And so it's very, very important that regardless of what culture you identify with or what religion you identify, the ideas of consent, respect, body integrity are human rights, and they supersede any culture or religion. And in fact, it's for all of our benefits to really align ourselves with the human rights perspective, especially about sex and sexuality, and for morality and judgment, because that's actually one of the first stigmas or discriminatory ways in which women particularly are held back.
And Dr. Mpume, you speak also very openly about growing up in a cultural family, in a certain culture, and you use your experience to counsel your patients in a way.
Absolutely. And I think to that is that you never have to be, whether it's inappropriate or have to step on your values, whatever your cultural background. It is all about understanding what the rights are and making sure that you are getting access to that. We will never be the same. We come from different backgrounds, but that should never be an infringing factor to the rights, and particularly the rights to pleasure. And of course, the power dynamics, those are things that need to change. They need to shift. We don't have to be disrespectful. We don't have to be inappropriate about it. And you don't have to infringe on your values, as I've said. But importantly, there's a big difference in saying, this is what I would like, this is how I would like it, and no one should infringe on that.
All right, well, let's just go Go back to basics very quickly, doctors. And I think when I think of sexual health and a body, you almost think of it as a car that needs to be serviced because it can't take you places and you ultimately want to get to the big O or several big O's, one after the other, I assume as well, okay, at the same time. So just some advice to women on how you can service your own body, because you can't tell somebody else what to do if you don't know what you like and what you don't like. Dr. D, some very quick tips for women, especially us over 40s, you know, who fall into bed tired and we need that help. We need that bit of oomph.
Yeah. I think I just want to say that, in fact, your body doesn't stay the same when you are a young person into adulthood. Perhaps you may have a children too, may not, and, you know, now perimenopausal, postmenopausal. Every single step and every single phase does something different to your body. The hormonal orchestra is different in each step, and then how you feel about your body, sexuality, and sexual expression may also be different. And your preferences, in fact, may also change and surprise you as you get older. And don't be shy to incorporate, you know, issues around lubrication, because it's not only people who are in pain, it's actually you experience pleasure. So I think for me, allow your body and understand that this is a...
Dr. T, we are losing your sound for a little bit there, unfortunately. We can't hear you very well. So, Dr. Mpume, I'm going to ask you to jump in and just some very quick tips from your side on how to spice things up for women and how they can take control of the situation.
Right. Also, what's important is that, as T has mentioned, your body is changing. What you want to do in your 20s is different to what you want to do in your 40s. It's a process. It's a journey. Be kind to yourself. Take the time to understand your own body. And I mean, things like from, you know, some people will have visual, whether it's porn, they can use porn. That's perfectly okay if that's something that is okay for you and in your environment. But secondly, it is about understanding when your body is at its peak, particularly in your reproductive years. Learn that in the first 2 weeks of your cycle, you're ovulating, especially when you're ovulating, that's when your sexual peak is at. Use and take advantage of that. And there's different, even within your cycle, you will want to have different kinds of sex during the cycle. Like I said, in the first 2 weeks, you're more likely to want to be on top. But in the second half of your cycle, you may want to be more intimate, more, you know, cuddly. And that is okay. Express those things to your partner, or, well, if you're by yourself, that's even better. And I think in particular, we shy away from talking about sex when it comes to menopausal women. One of the things that might hinder your sex life at that point is vaginal dryness. Use lubricants. Speak to your gynae about hormonal therapy if it is suitable for you, so that you don't forego your sex life just because you're dry and it becomes more painful. And last but not least, please do have your annual checkups, gynae checkups, because that will make sure that you look after yourself and you take care of any issues that may be underlying at an early stage before they get worse and literally ruin and interrupt your sex life.
Great. Well, and of course, be free to sort of change location. It doesn't all have to happen in the bedroom, I hear now. Well, thanks so much, Dr. Mpume. Thank you so much, Dr. Mpume, Dr. T. Thank you so much. And especially, yes, if there are 3 people going to be involved, you're going to need some props there from the pictures I'm looking at. We'll leave it there for now.